Hello and good morning. Today our topic will be cerebrospinal fluid. CSF is present in the ventricles of the brain, central canal of the spinal cord, and the cisterns around the outside of the brain. As you can see, this is the spinal cord and this is the brain. And this is the ventricular system, the canal of Schlemm and etc. And this is the cerebrum. And these chambers are connected with one another. The volume of the cerebrospinal fluid is 100 to 150 milliliter. The rate of formation is 500 to 550 milliliter per day. The CSF pressure, the average pressure is 136 millimeter of the water or 10 millimeter of hydrocarbon. And when one is lying in the horizontal position, meaning laying down, it is from 65 to 195 millimeter of water. And the secretion is 75% from the ventricles of the brain. Its functions are the mechanical functions. The brain floats in the CSF and its weight is decreased. The CSF provides cushioning effect to the brain, thus prevents damage to the brain due to jolts and jerks. Its metabolic functions are the metabolites and their breakdown products are removed through absorption by the arachnoid villi that is passed into the venous blood in the dural venous sinuses. So the formation and absorption of the CSF, the formation, it is formed about 2/3 is or more of this fluid is produced in the choroid plexuses, which are in the ventricles. There are the 4 ventricles, and mainly in the 2 lateral ventricles. And then the choroid plexus is a growth of blood vessels covered by a thin layer of epithelial cells, and a small amount of fluid is secreted by the ependymal surface of the ventricles and the arachnoidal membranes. And a small amount also comes from the brain itself through perivascular spaces that surround the blood vessels passing through the brain. And the CSF secretion starts with the formation of an ultrafiltrate of plasma, active transport of sodium through epithelial cells, lining outside the choroid plexus into the ventricles. And sodium also pulls chloride with it, and osmosis of water occurs and CSF is formed. The ependymal cells have tight junctions and act as blood CSF barrier. CSF has different composition from the blood, and it has no RBCs, only a few white blood cells. This is the composition chart. And then there comes the meningitis. Its causes are viral, bacterial, basically meninges, menin for meninges, itis means inflammation, so it will be the inflammation of meninges. Symptoms are headache, fever, stiff neck, vomiting, and altered consciousness and rash. Its findings are, in bacterial meningitis, CSF glucose is decreased while WBC's count is increased. Glucose is decreased, WBC's count is increased. In all infections, WBC's count, the neutrophil count is increased. In viral meningitis, the protein is elevated and glucose is more or less normal. Glucose is normal and only the protein is elevated in viral meningitis. In the flow of CSF, this is the flow of CSF. As you can see, these are the lateral ventricles. There are 2 on each side. Then there is the 3rd ventricle here. This is the aqueduct of Sylvius. This one. And this is the 4th ventricle. and this is the foramen of Meningitis, and this is the tentorium cerebri, and this is the foramen of Monroe. Flow and drainage. The fluid secreted in the lateral ventricles, mainly from the third ventricle, flows down to the aqueduct of Sylvius and then to the fourth ventricle. From fourth ventricle it comes into the third ventricle, then it goes to the aqueduct of Sylvius. Okay, and then there are the two foramina of Luschka and the midline foramen of Meningitis. Okay, there is the foramen of Luschka and then there is the foramen of Meningitis. And then there is the cisterna magna, which is continuous with the subarachnoid space that surrounds the entire brain and spinal cord. The fluid moves upwards from the cisterna and subarachnoid spaces surrounding the cerebrum, which is absorbed by the arachnoidal villi. And then there is the flow of CSF. As you can see, there is the cisterna magna. This is the fourth ventricle. This is the aqueduct of Sylvius, the third ventricle, and the lateral ventricles. What are coup and counter-coup injuries? When contusion or injury occurs on the same side as the impact, it is called coup injury. The front of the head is striking the wall here. If the injury occurs on the same side, it is called an hoop injury. When there is an impact on the front side and the injury is caused on the back side due to the brain striking the back side due to the inertia, it is called counter-coup injury. When a blow to the head is extremely severe, it may not damage the brain on the side of the neck, head, but on the opposite side, and the phenomenon is called counter-coup injury. The causes of raised CSF pressure. Brain tumors can decrease the absorption of CSF, and hemorrhage can occur in the cranial wall and increase CSF pressure. A large number of RBCs and WBCs appear in the CSF when there is a broken arachnoid villi and the absorption cannot occur. Decreased number or abnormal absorptive properties of the arachnoid villi, when blocked by the large particulate matter, fibrosis, or by excess blood cells, will cause CSF pressure to rise. Raised CSF pressure causes edema of optic disc called papilloedema. Precautions when you are performing lumbar puncture. When there is high intracranial pressure, do not perform lumbar puncture because this can cause herniation of the brain and the hindbrain can move towards the spinal cord. What is hydrocephalus? Hydro means water, and it is the excess water in the cranial vault. Okay, then there is the communicating type, meaning the fluid is flowing, and then there is non-communicating type, meaning it is present in only one place. In the communicating type, there are increased production, blockage of the arachnoid villi, and infections. In non-communicating type is caused by blockade, usually in the aqueduct of Sylvius or in the foramina of Meningitis and Luschka. It is also seen in babies due to developmental atresia before birth or brain tumor at any age. As you can see, this is a normal brain, and when there is water or CSF in the ventricles due to some blockage or tumors, it expands, swollen. Effects are they become progressively dilated. The ventricles become progressively dilated and leading to brain congestion and cerebral ischemia. In infants, in whom the cranial sutures are infused, increased CSF volume is particularly accompanied by the swelling of the head. Neural damage may occur due to the congenital hydrocephalus. Treatment can be according to the cause. Some types of hydrocephalus can be treated by the insertion of a shunt, which can open the blockade. It can be inserted from the ventricle to the peritoneal cavity. Blood-brain barrier. It is present between blood and CSF, and it is made by the epithelium of the choroid plexus. This is the blood-brain barrier. These are generally highly permeable, and these are slightly permeable to these, and totally impermeable to the plasma proteins because they are big and mostly non-lipid soluble, large organic molecules. Hey, we won't aim. Stop. I'm sorry, but you are too highly charged, too large, and not lipid soluble. It cannot enter the brain. They are saying this to the brain. The blood-brain barrier saying this to the proteins. What is brain edema? Abnormal cerebral fluid dynamics may lead to the development of brain edema. Edema means leaking of the fluid in the brain. And as the brain is encased in a solid cranial wall, accumulation of extra edema fluid compresses blood vessels, often causing decreased blood flow and destruction of the brain tissue. Mechanism are increased capillary pressure, which can cause leaky fluid, and serious blow to the head can lead to a brain concussion, and the brain capillaries are traumatized and the fluid starts leaking. And when there is edema, there is the compression of vasculature and decreased blood flow, which causes ischemia of the brain, due to which dilation of the arteries occurs, increased capillary pressure and increased capillary permeability, which causes edema again. It is called positive feedback mechanism. Basically, edema causes more edema. The end. Thank you very much for listening. Please like, share and subscribe.